You ought to be able to record in that hub or in that system where what was dispensed, or if none was dispensed or part dispensing, so that the information is available to all who may need it. And so we go back to the hub system that I'm talking about. So we see here, right, based on what we require, the patient who is going to be using this station, the patient is free to choose any outlet, right? Just as the patient is free to choose any prescriber. And the patient who has, whether they have surgical or Medicus, whichever provider they choose to use, all of these players are free to access information from the hub, right? Now, basically, it boils down to three simple steps if we remove all of that. We want the authorized prescriber to be able to send information, right, to the central depository, and that authorized dispenser would be able to access information from that central depository. So for our Jamaican context, transmission, the major considerations we have is that we want transmission of the e-prescriptions to the dispenser should be via a system where the paper prescription is the legal entity, or is it that we say that the electronically sent prescription is that legal entity? Right now, the law requires that every prescription be kept for 2 years. Now, that's a paper trail, right? The law says nothing about electronic storage. So there is a legal requirement for that to be adjusted. So the authorities need to come to a decision. Is it that the paper that we have now, that is what is legal? Or is it that whatever is stored in that electronic hub, that is the legal prescription? The council, the pharmacy council, requires every pharmacy and pharmacist to store those prescriptions for 2 years. The insurance companies want you to store those prescriptions for 7 years. They can audit you up to 7 years. So it means, therefore, the electronic use of the electronic prescription storage as a scanned document or in a hub will facilitate a 7-year retrieval, much easier than the paper, right? So for us to move forward from where we are, it is very important that we have standardization of all that is happening. We have to pull all of the different things that are happening. We have to get to the point where we say this is best for our situation. It means, therefore, standardization of all of the software that is on the market now. There are about 5 of them, right? We need consultation. We need what are the mandatory measures that they must meet in order for them to be registered. Some of the worldwide standards that we have looked at and which the public can look at to see what is the framework I have just put together here. So you have semantic implementation guidelines, work packages. There are several of them. Digital Health Australia's national requirement. We have the UK, we have the Canadian document, which can be used as a source and guide for what we will actually implement within our jurisdiction. And we are a good way ahead. Already in consultation, the Pharmacy Council of Jamaica, Ministry of Health, and the Minister of Health, they have already established an advisory committee There were terms of reference that were developed and identification of a project head with an outline as to how long this should take. Now, there has been the need for this to be speeded up, which as a result of the COVID-19. So there's a lot of pressure now. Let us have electronic dispensing now. However, with all of what I have said before, there is a need that even though there is an urgency for it, we must ensure that when what we implement is not going to be more harmful in the long term. So far, this is where they are. Other things that need to be done. We have to recognize the funding. How is this thing going to work, right? Adjustments to the legal framework. Right now, there is nothing in the law which speaks to electronic prescribing. It speaks to electronic transmission of a paper prescription, right? Which is different. And under the law, some good lawyers can come up and mince us if we don't have it clearly established. As I mentioned, development of standards for the operators. We have to have consultations with the stakeholders, the general public, the different providers, all involved. We have to test it, we have to review, and before we can actually go to full implementation. Why is all of this so important? Because patient care is the most important thing, right? The patient must have the right to choose. They must have protection for their private information, and we must have the legal support in order to move forward. The Pharmacy Council of Jamaica, Ministry of Health, Patients' Right Advocate, Jamaica Association of Pharmacy Owners, the Pharmaceutical Society of Jamaica, the Medical Association, the MHA, the Standards Department of the Ministry of Health, all of these organizations and persons must come together in order for us to focus and come up with a system that would really address all of the needs and meet for successful implementation. In the interim, because of what is happening with COVID, some solutions right now, the law requires, before COVID, the law requires, as I mentioned, if you sent an email or you sent a WhatsApp prescription or you had a call-in prescription, within 2 days, you would have had to go have the original taken to the pharmacy. However, the minister has made an adjustment, and the law, it now states that it's within 5 days. So within 5 days of having made that call or sent in that WhatsApp prescription, the original should be taken to the pharmacy. However, that is not the best situation, and persons still find it very uncomfortable to have to follow through. So in the interim, before we get to this perfect hub, which we speak of, some suggestions: providers can submit applications to the Pharmacy Council to receive the letter for temporary usage. Now, a lot of providers have already done that, right? All the software standards, all software should be web-based, and it should be downloaded free of cost by all pharmacies. Either the patient could be given a code or a card or a password, and this patient should be able to access the information, access the medication at any pharmacy. Providers of e-prescribing would need an updated list of the providers. Now, this is a very serious matter because you may send out a prescription electronically, and there is no record in the system of this provider, right? So, and there would need to be a digital signature as well for authentication. So that's another matter that must be standardized. The recognize the downloaded prescription original by inserting a security feature. So they will have like a code or a QR code or something that is going to be able to bring up that prescription. If you go to the pharmacy of your choice and the prescription is partially filled, then there should be some method where that information can be entered into the system. And so if the patient goes to another pharmacy, that information of the part filling of that prescription would be recorded. If the patient requires a written copy of that prescription, then that can be given to the patient, because as it is, the paper prescription still remains the legal or the only legal method of storage for approval from the pharmacy council. Of course, providers should, and that is covered under the law, to sign an agreement that the patient's information and data would not be shared for any purposes outside of what it was intended to do. And given, if we can meet those simple requirements, I believe that we can be one step further to actually having a temporary implementation until the perfect scenario where we have the hub and where we have the free electronic transfers can exist. And so I thank you. Those are my references.
Thank you very much, Dr. Watson. A very interesting presentation. One of the things I noted was the fact that COVID-19 has spurred, it has been a catalyst for an accelerated implementation or approach to implementing this particular new way of fulfilling our prescription. But my question to you is, and I'm sure other Rotarians have questions, but my question to you is how, what time frame in your estimation do you think we will realize e-prescribing in Jamaica? How long from now? I know you probably don't have any control over certain things, but in your, if you should guess how far in the future you think this would be a reality, what's your guess?
Okay, what I can say is how long we have been working on it. The initial presentations by providers to the Pharmacy Council might have been about 4 to 5 years ago. The actual work, consistent work, has been ongoing for at least 2 years. And based on where we are and the urgencies, I think an interim solution can result within 6 months, and the actualization of e-prescribing, that I would leave up to the Pharmacy Council and the Ministry of Health to make that determination.
All right, thank you. Do we have any questions from our Rotarians, our guests, for Dr. Watson?
Okay, so I saw a question come up in the chat. If you get a prescription for a particular pharmacy, who would have the authority to move that prescription to another pharmacy if you decide to go to another pharmacy? So that is one of the the standards that we would want to see, where the prescription, the authority is still owned by the patient. It therefore means that the patient still has the right to request from the doctor that the prescription be sent to any pharmacy of their choice. If the pharmacy of their choice is not able to fulfill the requirements, then there needs to be there should be an ability for that pharmacist to write the whatever is not filled, and so the patient can have a written copy. Or if we have a system like a hub system, then the pharmacist will document what was filled and send that information back into the system, so that patient is now able to access whatever is left. If there is a repeat on the prescription, or if they choose, in our situation, many of our patients part fill. So they will say the prescription is for a month, but give me 2 weeks, right? That documentation is normally made on the hard copy, right? Or the electronic system, it is desirable for that information to be sent back electronically to the hub, so that the patient is now able to access that information at any other pharmacy who is a part of the system. Of course, there are going to be some pharmacies who may not be willing to participate in electronic provisions. That is a choice for the pharmacy, because it's one of the barriers, right? The return on investment. Take, for example, if that pharmacy is situated in a rural area of Jamaica, where most of the persons don't use electronic, anything electronic. So that pharmacy may have one or two patients who may wish to have electronic prescribing. And therefore the cost of getting the equipment to support electronic prescribing may not be a wise decision for them.
All right. We probably have time for one more question. Is there anybody online right now who has a burning question you need answered in regards to
Yes,
e-prescribing?
I've sent some questions in the system already. Who will own the system one? How will you identify? This is Vernon Darby. Sorry, good afternoon.
Good afternoon.
Who will own the system for prescription? How will you uniquely identify each patient when we do not have a national identification system as yet?
Okay, so let me answer the first one. Each provider will have to have a unique number for the patient. So it's just like your NDC when you fill with the insurance. Each drug has a specific identifier. So on any system, each patient will have to have an unique identifier. The other part you will asking is, if you do not have a hub, a national hub, how would you send the, is that what you are saying? Repeat that part of the
Who
question.
owns it?
Who owns, who will own what?
The hub.
No, who will own the system general? Because you have to have a system, hub, everything, the software, so who will own the system?
Okay, so the individual providers without a hub, right? The individual providers will own their system. However, there must be interoperability. So it means, therefore, that if you use system A must be accessible from someone who is using system B, right? In order for you to have, that's why we are saying it should be web-based.
Could I
Right?
just add a point here? When you say providers, you're thinking of the insurance providers?
No,
Who is it?
the providers of the electronic prescribing systems. So you have your insurance providers, they will be feeding into the system, right? You have your prescribers, they will be feeding into the system, and you have your pharmacies who will be dispensing from the system to your patients. So the providers of the electronic systems, right? They are the ones who you would have to interact with. Now, the ideal situation is that you have a hub where each of these providers will have to feed into that central system. Outside of that, we have to have where system A will allow system B to access information. And I think, quite frankly, that is part of where the issue is, because persons may not want to have another provider, another electronic prescriber provider accessing their system. But it is impossible to not have interoperability if you are going to allow all persons the freedom to use the systems. It means, for example, if a physician would have to have system A, B, and C in order to satisfy, the pharmacy would have to have systems A, B, and C in order to use it, right? So the issue is we must have some kind of a central authority where you can all feed the information into. It may be even, say, for example, the largest provider who covers the entire island may be the one who will act as the hub. That is left for the authorities to decide.
Can I squeeze the final question?
Sorry?
We're pretty much out of time. I'm supposed to finish at 2 o'clock. But you can certainly continue the conversation after the official Rotary Club meeting is over, because we'll still have the Zoom link up. So if you want to ask questions, you feel free to and talk to Dr. Watson. But I have to close out the meeting now. We should have finished that too. So at this point, I'm going to call on a Rotarian to do a quick vote of thanks. Past President Edie, are you available to do a vote of thanks for our guest speaker? If you are, please go ahead.
President, I was in a meeting, but I'm sure the information provided by Dr. Watson was very informative, and we thank her for making time to be with us today to provide us with that information. Thank you again, Dr. Watson.
Thank you very much.
Thank you. Thank you on behalf of the Rotary Club of Downtown-Kingston, Dr. Watson. We really appreciate it. All right, so let me call on, who can I call on now to do the, all right, Past President Lincoln, can you do the toast to Ara and a club of your choice? VP Lincoln? Not hearing you, all right. So I will call on.
You call my name, Press?
Yes, Past President Lincoln. Can you please do the toast to Ara and a club of your choice?
Wow, I have 3 clubs to choose from. It's gonna look prejudicial if I don't choose at least 3 of them. So I ask you all to join me in a toast to RI and the Rotary Club of Kingston East and Port Royal, St. Andrew North, and New Kingston.
St. Eastern Port Royal, St. Andrew North,
And New Kingston.
and New Kingston.
Okay. Sure.
All right, Rotary Club of Downtown-Kingston meeting ended. Dr. Watson, please, you can feel free to take questions from members or from Mr. Darby, if you wish.
Dr. Watson, I think one of the questions was who pays for the software, the hub, the so-called hub software, which would have to be some large server somewhere, possibly off the island, but who pays for that?
Okay, so initially, one of the proposals would be, say, for example, the National Health Fund. They would own. You see, you have to have, it's important that we have a neutral party who would manage. and would be able to, persons will have confidence, right? And based on the operations of the National Health Fund, thus far, they are one of the bodies that are held in very, very high esteem among both the patients and the healthcare professionals. And so, in my opinion, I would think that they would be an excellent choice for having ownership and management of the hub. Outside of that, the Pharmacy Council is another body that can be invested the standardization and control of what happens amongst providers, because already the Pharmacy Council regulates and manages the entire profession, pharmacies, pharmacists, anywhere drugs are stored, distributed, etc. So in terms of control, they would be another body that can be that would be likely to have control of it. However, I think in terms of the financial ability, the National Health Fund would be much better pleased to do so.
Okay.
Doc-
A quick follow-up. Is there an area where savings would be realized? For example, savings to go towards this. Just like how, for example, the banks intend to fire everybody and go electronic and probably close the banks. Is there any area where we will see savings in this system?
Well, you will certainly see savings in terms of man hours, time lost,
Okay.
errors in prescriptions, because a lot of the errors, I'll tell you, on a daily basis, a pharmacist will spend in total at least 1 hour trying to decipher what is written on that prescription. Right? And we everyone thinks that we are magicians to be able to read them. But there are times when we are stumped, and we have, we share amongst ourselves. Just earlier on, before I came on, I saw a prescription. Somebody asking, can you identify item number 4? When I looked at it, I laughed. I mean, my God, this one is a code one. So you spend time. And then in terms of the patient compliance, because information that can be accessed from a central hub will help the patient.
Okay.
Dr. Watson.
Can I make Dr. Watson?
Yes.
Vernon Darby here. I don't think it is wise to have a regulatory body involved. We've seen what happens with other organizations like NSWMA. So it is best to separate the regulatory body from an operational thing like this. That's the first thing. I would not, if I were you, I wouldn't go down that road at all.
So you are suggesting that the NHF is a better?
No, I'm going to go further. The NHF is also a political organization.
Mm-hmm.
And the board is appointed by the government in power.
Okay.
We do know that when it comes to government, there can be certain amount of instability. Therefore, as done in the travel industry, where the players become the ones who run the system, it seems to me, you probably won't have the capital, but it seems to me that the owners of the business ought to be the ones to regulate it and manage it, and to stay away from any sort of direct political interference. Political should have to do with regulating and oversight, but not direct involvement.
Well, if you look at what happens all over the world, the government health authorities are involved and play a major part in all of the systems. In the US, a private body, which is the Pharmacy National, it's a pharmacy association. They invested heavily in collaboration with the insurance body, right, to invest in the system. They have a lot of problems there as well. So there is no one method that really works to fit all, but based on the best serving systems right now, which is like Australia, New Zealand, the hub is owned by the national health systems, and they so far have had the best results. Norway went part private, part government, and I think they are in the process of going totally government, because believe it or not, private sector is about profit, and a lot of the times these things require more than to be able to make a profit.
Could I just interject? I was saying go private. Government can also assist, but I'm talking about managing the system. You can set up an entity, whether it's a limited liability company or what. Government can provide the capital in other persons, but what you would not want to go into, and I'm telling you based on my experience, you would not want to go into a system where government appoints a board. Now, in large companies like America or those Australia, the sort of small island mentality which operates, you're not going to find that in Australia. Now, I'm telling you from experience, many years experience, working with government, that I'm suggesting to you, do not go down that road. Suggest to them that they provide the capital, you set up a separate entity, you have your own board, your members become a part of it, you select your board members and you run it in an independent way. It does not alienate government. Government have representatives, but the moment you are going to have any agency where government, and I say government, is a minister which appoints a board, appoints every member, Mark Merritt in a small country like Jamaica, and the history that we have had, and I'm speaking from recent experience, I put it to you that you're going to have challenges.
Okay.
And you know what I'm talking about.
Accepted. As I say, there are many proposals that will be considered, I am sure, and based on the team, they have set up a implementation team, an advisory committee, and that body involves private sector, patients, professional bodies. So I think at the end, the advice from that implementation body would be considered.
Question. Will the system tie into the hospital patients' files, electronic files, if they do exist?
That's okay. The if you want to have a private and public combination, then that would happen. But if it is a private system, then you would not have the hospital being a part of the system, because right now the hospital, university hospital, have their electronic system. In they are moving away from the paper-based system. So again, the committee is going to have to look at all of these options and choose what is best for us.
How do you guard against overprescription of your dangerous drugs, your painkillers, your
Well, that is one of the most effective ways, because remember, you will now have an electronic trail. So, for example, if the patient goes to a pharmacy in Montego Bay, right, and taps into the system, gets their medication, that information is going to be stored in your central depository. And therefore, if it's 2 days, 10 days, 1 month after he comes to a pharmacy in Kingston, that information is there. So that is one of the benefits of the electronic prescribing system.
Thank you, Doctor.
Thank you. That's been my pleasure.
And I must say, I'm very disappointed that you're no longer the president.
Well, listen, you have some, You will be surprised. I will hear you say, oh gosh, Dr. Watson, why you never bring her on before? She's excellent.
All right, so you'll introduce me to her, so I will be working with her then. All right.
Definitely.
It was great working with you.
And thank you for all of your help.
No problem. I enjoyed doing it.
Okay. Thank you.
All the best. Then.
Okay.
Bye.
Bye-bye.
All
Bye.
right, bye guys. Take care.